All right, welcome everyone to the MS Health in the Public Interest seminar series. We meet here, as I'm sure a lot of you know, every Wednesday afternoon from 12 to approximately 1:15. 1:15 will be our hard stop for this lecture today. But a lot of our speakers are very forthcoming in answering questions, following up afterwards. So I'm sure Dr. Williams will be happy to keep the conversation going after this lecture. We're really happy to have you all here. This is a program that is part a course for students within the MS program and partly a public lecture series that's open to all of you beyond the MS HAPI program. So thank you again for joining us. We feature a new public health leader every week where they talk a little bit about their research, what they're doing in public health with a specific focus on the non-medical aspects of the healthcare field and how we can create a better healthcare system for everyone. I'll post some information in the chat about how to keep up with our program, follow our socials, for more information, to sign up for our newsletter where we send out weekly invitations to the seminar series, other program events and going-ons, and other ways to get involved with the world of healthcare and MS Happy at Georgetown University. With that, I will turn it over to our student moderator for today, Noah, to introduce our speaker.
Thank you so much, Jenny. Hello to my professors, my happy classmates, my fellow audience members, and a warm welcome and big thank you to Dr. Williams for taking the time to be our guest today and share his expertise with our group. So a little bit about Dr. Williams. Dr. Williams began his career as a middle school science teacher in Washington, D.C. public schools while earning his master's in the arts of teaching from American University. He went to pursue medicine at Johns Hopkins School of Medicine, followed by residency training at Yale University and a fellowship in child and adolescent psychiatry at the Children's Hospital of Philadelphia. So today, Dr. Williams is a child and adolescent psychiatrist and associate professor in the Department of Psychiatry at MedStar Georgetown University Hospital. His work bridges clinical care, education, and advocacy, and focus on school-based mental health. And he provides direct mental health support to schools as a part of the MedStar WISE MedStar WISE program, which stands for Wellness in School Environments. He's the co-executive director for the Early Childhood Innovation Network, a research practice and policy consortium focused on advancing early childcare development in Washington, D.C. He's also a co-director of recruitment, retention, and climate at MedStar Georgetown Department of Psychiatry, as well as a co-chair of the National Anti-Racism in Medicine Curriculum Coalition. So throughout his career, Dr. Williams has deeply integrated community-based participatory research into his work, ensuring that initiatives are responsive to the needs and voices of a whole community, which is the basis of what he will be discussing today in our seminar. So again, a warm welcome to Dr. Williams to our seminar series, and I will turn it over to you to begin our discussion.
Oh my goodness, thank you so much for that warm introduction. I'm super excited to share this content with you all today. And let me, as I'm sharing my screen, let me just express my gratitude to the whole planning team to make this work today. And I'm excited to share with you some lessons learned, particularly in my role as a co-director of ESIN, or Early Childhood Innovation Network, which is really about academic and community partnership. And I understand you all have had some content related to healthcare disparities, and I think that academic and community partnerships play a really important role in sort of tackling healthcare disparities. And I hope that today's content will be sort of thought-provoking, instructive, especially for those of you who are doing research or public health or wanting to get involved in research. So today I want to talk to you about using community-based participatory research in addressing to address structural racism in research practices. And I have nothing to disclose today. I want to start off with a vignette. And this is a real case that we had to deal with in my research network. And I've kind of changed some details to protect identities and such. But this was more or less the spirit of the case is real. So I want to do a couple of things. I'll throw the link to the vignette in the chat so folks can pull it up on their end. If you can't pull it up on your end or have any trouble, what I'll do is I'll pull it up here. And let me zoom in a bit to make it easier. It's a few paragraphs. So I want to just take 2 minutes for folks to read this vignette. And then I'm going to take some questions take some answers to for this question, the reflection question at the bottom. So 2 minutes to read the vignette and then reflect on the question, and I'll take some volunteers. Okay, 1 more minute. Okay, about 10 more seconds. All right, so I'll ask folks to unmute and share, and if you can't, go ahead and use the chat as well. But I just want to ask, well, let me first summarize. So this was a group of researchers who had, conceptualized a group-based intervention that they wanted to implement at a local school site for the parents at that school site. And over the course of some meetings to roll out the project and the research, something went wrong where tensions were built and sort of trust in the research team was eroded, and ultimately the project was unsuccessful because they just weren't able to generate enough investment at the school site for the project to move forward. So, from your reading of this vignette, what went wrong here? No right or wrong answers, just your reactions to this scenario.
I can start, but I would say that what kind of went wrong was just this kind of failure to engage and prioritize the community opinions
Mhm.
and the prioritization of the academic rigor of the research instead.
Right. Yeah. So it sounds like there was a maybe a sort of a guise that the community would be involved in how the project would be rolled out, and then it turns out that they didn't have much authority. So their involvement was sort of underappreciated at multiple stages in the research project development. So good. I think the next hand I saw was Haley.
Yeah, just to kind of build off of that as well is like they open up the field like the floor for feedback and then they took all of that feedback and then they decided not to do anything
Right.
with it, which I
Yeah.
think also like really draws a line between trust where it's like, oh, well, we don't really want to hear what you have to say, but we're gonna pretend like have the guys that we do. And I think that also like led to like a lack of trust with the researchers because I think any of us could imagine like somebody being like, I really want your feedback and then I'm not gonna take it.
Well said. That's well said. Yeah, and you can imagine from, the school staff and community partners here, their experience of feeling like, okay, I have a say, and then nothing changed, or the researchers didn't respond to their feedback. So you could see how that would sort of undermine a partnership, a genuine partnership there. So well said. Thank you. I think the next hand was Taruni.
I was actually going to say something very similar to what Haley said, but to add on a little bit, I think especially if you're taking into account what the school said and the local facilitators say, and you're not really accounting for that. It's also difficult for them to become involved. And then if the local leadership is not involved, very, very difficult to have parents and students involved.
Right. Excellent. Well said. So, in order to engender participation, there really needed to be investment at the school level and among staff so that they could promote or help you recruit or help you facilitate the groups, et cetera. So there was really a necessity for community partnership from the very beginning. So well said there. And then I'll take a couple more. Molly, go ahead.
Yeah, I think one of the things that stood out to me was the title of the study.
Yeah,
Um,
go ahead.
can you hear me over the airplane? Sorry, it's loud in here.
Yeah, you sound
Okay.
fine, and I'm glad
Okay,
you.
perfect.
Yeah, what about that title?
I mean, maybe that's like a title you would use like when you publish the study, but it's making a lot of assumptions about the community. I think there could have been a way to phrase that. And also, I just, even if, yes, the majority of like the families involved in the study like were low income, I don't think that like labeling it that off the bat is
Yeah.
helpful to anybody.
Yeah, exactly. No, well said. And to your point, there was a whole range of assumptions made with this title, and it sounded like they didn't actually really know. They were sort of, they didn't collect any socioeconomic data, so it's debatable whether or not that's actually true. But aside from the point, why is that the terminology that you want to lead with in terms of promoting the study or what to call the study? And it just kind of goes against the notion of being strengths-based and asset-based and thinking about communities based on their strengths and not what's wrong with them. So I'll touch on that a little bit too. So thanks for that. That's a really good point. I think I saw one more hand.
It was me, but Molly got just what I was gonna say.
Okay.
The title was really alienating and judgmental,
Yeah.
so she got it.
Exactly, exactly. And you can imagine from the perspective of staff or the participants, this is not what you want your group, to be named as or sort of, to be led with. And I see, thank you, Jennifer, for your chat, lack of collaboration between researchers and target community. Absolutely. Okay. So again, I'll refer back to this case because again, this was a real case in my research network that we had to deal with, and in some ways are still kind of um, dealing with the sort of the legacy of. But this was, I think it's also important to kind of share what our challenges have been, and how those have really strengthened our network and really generated some good lessons learned that I wanted to share with you. I'm excited to share with you today. Um, so today I wanted to speak to this issue of academic and community partnerships in the context of research and public health work. And by community, I mean any community that's situated outside the university. So you could kind of insert here a community health clinic or a primary care center or a school or a faith-based community or a recreation center, et cetera, where you have people not only receiving services there, but you have staff and professionals that may have their own community and their own dynamics, and own norms of behavior, et cetera. And the argument that I want to make today is that while these academic and community partnerships are really important, and there's valuable and wonderful work that can come out of it, that they've been patterned interactions and sort of specific arrangements that often have caused different forms of harm and play a role in maintaining harmful hierarchies, sometimes gendered hierarchies and racialized hierarchies. And if we're not careful, we can play a role in upholding those patterns, and sort of play a role in sort of maintaining a status quo, if you will. So I'd like to start off with some key questions just to frame the talk today. So what I'd like to cover is what have been the common pitfalls of these of research within communities? What is CBPR and how can it be used to repair academic and community relationships? And then I'll share some examples. And I want to share an example from my work in the ESA network, or the Early Childhood Innovation Network, which is a partnership that was formed in 2016 between two academic centers, Georgetown and Children's National, and about a dozen community-based organizations in Washington, D.C., with a specific focus on Ward 7 and 8. And those are two areas in the city that have been subject to decades of public divestment, resulting from a relative dearth of health, education, and social service supports compared to other areas of the city. And the primarily Black population of those wards forms a really vibrant community with rich cultural and historical roots in Washington, D.C. And within ESON, we've launched several intervention pilots focused on caregiver and child mental health, peer support, child social and emotional learning, social determinants of health, and community-based support to families within these select sites. So I want to share with you, so this is really kind of our world, and we kind of swim in this world of academic and community partnerships. And so this area has been a big focus for myself and my team, and I'll share some examples from that work, which we recently published in the Journal of Mindfulness. So I like to start off with this quote from Linda Smith, who wrote this book called Decolonizing Methodologies, Research, and Indigenous People. And she writes as a Maori, someone of Maori descent, which is the indigenous community in New Zealand. And she wrote this book about the problems with research in her community. And she writes, from the vantage point of the colonized, a position from which I write, the term research is inextricably linked to European imperialism and colonialism. The word itself, research, is probably one of the dirtiest words in the indigenous world's vocabulary. It stirs up silence, it conjures up bad memories, it raises a smile that is knowing and distrustful. The ways in which scientific research is implicated in the worst excesses of colonialism remains a powerful remembered history for many of the world's colonized peoples. It is a history that still offends the deepest sense of our humanity. So, I mean, it's a really rich quote, but I think there's a couple main takeaways here, which I think is important to keep in mind, which is that there's sort of a mindset here that I think is represented in this quote, which is that just because, you have good intentions, want to do good health research, want to advance the health of communities, doesn't mean that you're not tied up in history, and particularly dark histories of oppression and stigmatization of marginalized communities and formerly colonized communities. So this is a history that still very much lives in many marginalized communities, and especially in the United States, Black identifying communities and indigenous communities and other communities of color that hold a lot of stigma towards scientific research. And it's something to acknowledge and to sort of notice when it comes up in different dynamics. So there's a sort of a mindset thing here, which is that we can't think of ourselves as sort of an objective and neutral good for our community when we come in as a researcher, and that we are still having to deal with the legacy of this sort of pattern of research abuses. And that, just to touch on some history that, be too much to cover here. And much of this history has been detailed by scholars like Harriet Washington, who wrote, Medical Apartheid. But I'll share some poignant examples here. You can think about the early physicians and researchers in colonial America that participated in the slave trade through slave appraisal at auction blocks, and some of the first roles that a physician or researcher could have was working on slave ships. To histories like J. Marion Sims and sort of his experiments on non-anesthetized, non-consenting enslaved Black women for his gynecologic experiments. Famous examples like the Tuskegee experiment, where over 400 Black identifying men were subject to syphilis without treatment. Treatment was withheld. To more contemporary examples, and not to pick on Johns Hopkins, but it's a salient sort of local example in Maryland where there was a case that went all the way to the Maryland Supreme Court, where pediatricians out of Kennedy Krieger, which is situated within Johns Hopkins, had knowledge that predominantly Black kids in East Baltimore were exposed to lead. And their study was to sort of observe the effects of lead and sort of chose not to intervene and chose not to inform parents about the lead exposure. And so there was some real ethical problems with that study, and Kennedy Krieger ended up losing its research license for some time because of that. So again, not to pick on these sort of like handful of examples, but just to show that there's a whole history and a pattern of research abuses that even if people in the community don't have actual memory of these incidents, they have historical memory that which is largely passed down through stories and oral history that we are as researchers sort of a part of and connected to. So again, something to sort of be aware of and understand how it might manifest in your interactions with a member of the community as a participant or an organization. And there was this great report called Chicago Beyond, a report that came out of a handful of community-based organizations in Chicago that had worked on university and community partnerships. And they put together this report, which kind of outlines some of the problems and pitfalls that occurred in their interactions with university-associated researchers, and tried to outline some of the trappings and common pitfalls. And one of the things that, part of the frustrations that came out with in this report was that, people just felt like they were being researched all the time. And what did that feel like? It sort of felt to many of them sort of feeling like under a microscope, that something was wrong with them, that the researchers were casting stigma upon their families, et cetera. So started with this question, which is that like why are our communities always being researched? And I think the main takeaway, and I'll go into some more specific examples that came out of this report and some other scholarship, but our sort of traditional research practices, have embedded structural inequalities in them, which can maintain and exacerbate inequalities. And again, many times racialized hierarchies and gendered hierarchies and socioeconomic hierarchies and different forms of hierarchies. And that research actually plays a role in sort of maintaining and upholding that. And when I say sort of, Western or biomedical, I'm kind of recalling that many of the sort of the intellectual traditions that compose many of our research practices. For example, randomized clinical trials and the methodologies and the priorities in that form of research are really rooted in European intellectual history. So that's what we mean by sort of Western research. And randomized clinical trials are sort of, the sort of prototypical example of the what is thought of as the most empirical and most kind of trustworthy type of research. And what they outline in this report is that there was structural inequalities that were embedded in the traditional research practices at each stage of the research projects. And just to kind of roughly outline, of course, there's many more stages than this, but just for the purpose of today's talk, I'll roughly sort of outline these steps, which is that, at project conceptualization, at implementation, at data collection, at data analysis and interpretation, and at dissemination, there was inequalities that had arose between the university researchers and the community. And I'll touch on a few examples here. So I think as we saw and folks commented on really eloquently in the vignette, at the stage of conceptualization, you read that the researchers were really getting together and thinking through the questions that they wanted to ask and their research priorities and the measures that they wanted to use. So right then and there was a problem there, which was that the conceptualization really started with a small group of researchers, and that typically individuals in the community are approached by researchers without necessarily addressing any community stated needs as kind of one of the patterns and problems that comes up. The researcher's relationship with the community is minimal and based on a researcher and participant relationship. In other words, people are considered human subjects and not partners and not leaders and not key contributors. Research questions stem from a professional imperative to contribute to generalizable scientific knowledge, meaning that we generate the questions and priorities such that we can publish and present at conference, and we sort of accrue prestige, promotions, and opportunities based on this work, which doesn't accrue equitably to our community participants and community partners. And then typically the researchers seek out and secure the funding sources for research projects. At the level of implementation, data collection and data analysis and interpretation, again, just to touch on a few examples. So typically in our research worlds, the project designs do not change over the course of a project, which can be really problematic, as we saw in the vignette, when key stakeholders like staff and participants have feedback and important feedback about design, about logistics, about measures that we have to be able to be flexible and adjust, and sometimes sacrifice what we call fidelity, or the sort of the way that projects are supposed to be delivered the same way. Researchers design interventions and program to be tested within the research projects. Again, researchers choose measures, and this becomes really important when, for example, and I'll talk more about this, we had participants filling out, a battery of assessments that we chose as researchers and didn't necessarily incorporate any community feedback. And some of those measures they felt were actually quite offensive and made them uncomfortable and were pretty onerous in some ways, and that we would have just gotten much more investment if we had actually incorporated some more community involvement in the choosing of the measures. And then this final stage of dissemination, in other words, the ways in which in research we share our findings. And I think we take for granted a lot of times that we'll eventually share findings in our academic publications, and present at our academic conferences, as we typically do in the research world, which again has value. There's nothing necessarily wrong with that, but it becomes problematic when those are opportunities that accrue benefit to us in a disproportionate way, and we're not sharing lessons learned in more community-based strategies. And I'll talk about what that could look like too. And again, programming and interventions are typically only implemented within research timeframes and are discontinued after the research project has ended. And this is really key too. And I think, for the scope of this talk, I just wanted to share a brief intervention, but you could imagine that you could expand that analysis, and that might have been the 100th research team that approached that school for a project idea. And from the school's perspective, it's like, here we go again. Another research team that wants to do a project with our families and doesn't have a long-term commitment to this community. And maybe our families will benefit for a short period of time, but then when it's over, they leave. And they've sort of, collected their data, and then that's the end of our relationship. And so more often than not, that's actually what happens. And so when you are in these relationships, sometimes you have to make an extra effort to show your long-term commitment and your commitment to the community, et cetera. So all that's to say, and I hope I've sort of made the argument today that the relationship between research institutions and many communities is in dire need of repair. And this necessitates a renewed long-term commitment to health equity and anti-racism in research practices. And I think, or it's my belief that CBPR, or community-based participatory research, is one strategy among many to sort of bring to bear some anti-racism approaches in research, and is an important approach to start to repair these relationships, and a good framework for us to think about how we can incorporate genuine community partnership in our projects. So I'll just start with some basic definitions and some principles, and then I want to show some vignettes and have you all thinking about some other vignettes. So CBPR is a collaborative, strengths-based orientation to research that equitably involves researchers, community members, and other stakeholders in all phases of research while embracing their unique expertise and contributions. And, in my experience in our sort of mainstream traditional master's programs and PhD programs and research fellowships, that CBPR is really not covered. And this is a whole field of expertise, and I'm not going to do justice to it today, but just something for y'all to know about that there's a whole expertise around how to engage communities, and it requires knowledge, expertise, and key strategies. So I just want to sort of whet some appetites today, but just know that this is a whole field of research that can really give you some tools in your toolbox to build community investment. There's some key principles, and Susan Collins' work out of Washington State has written some great work on this, and then Nina Silverstein is in New Mexico at the Center for Population Health, and it's really at these kind of centers that focus on CBPR where you get a lot of this content. But again, I think sadly, sort of this is left out in a lot of our research training. So I'm glad you're getting some of it today. But CBPR is it thinks about community as the key unit of identity, meaning that in general, if you're using a CBPR approach, you're not really thinking about people as individuals with diagnoses or problems, but more so you're thinking about communities and your participants as existing within a community. And so your frameworks and your metrics and your outcomes will reflect the fact that you are thinking about this as a community, as people in community. Researchers acknowledge and promote community strengths. Again, moving away from that really fraught title that we talked about, for example, but thinking about, well, what is actually going well here? And you could think about community strengths like their connection to history and their connection to their school community or their faith-based community, et cetera. A range of community strengths that you could actually highlight in your project. CBPR also seeks to address real issues of race and ethnicity, sexism, social class, and embraces cultural humility. So it tries to grapple in some way with the ways in which people may be impacted disproportionately by different forms of discrimination, and how can you sort of incorporate that into your project plans. It's guided by ecological multi-determinant perspectives, meaning that we understand that health is a culmination of factors, many of which are socially determined and socially constructed, like issues of poverty and employment and education, et cetera. And it aims to build equitable research partnerships, as I've alluded to. So the key question here when I think about CBPR, and what is CBPR? It's really this question, which is, what does it mean to do research with communities instead of on them? Meaning, how can you think about genuine partnership in the research, as opposed to thinking about your communities as subjects? Well, and this is a really important tool that we use in my network and is an important framework in the CBPR world. And I'll just talk through it here quickly. So the idea is that community involvement is really a continuum, and we should try to at least strive to build some sort of this sort of rightward construct, shared leadership at each stage of the project development. And just to name it, this is really hard. And again, it requires expertise and sometimes can be slow and complicated. But I would say, from my experience, the benefits sort of on the back end in terms of like how to build a really prolific research portfolio and really be producing work in a way that's lasting and sustainable and leads to a really productive research partnership, that this shared leadership is really key. So even if you can't get there with each step, there are ways to sort of advance forward towards this rightward construct. So let me just talk through a couple examples here. So on on the left hand part of the continuum of engagement, you have outreach. And this is really where we're just kind of informing folks about a project or an initiative. And so the communication really flows just in one direction. So this might be, for example, a flyer distribution campaign or something on social media, kind of making an announcement at a staff meeting where you're just kind of informing people that this is an initiative going on and we'd like you to take part of it. Again, not necessarily wrong, but there are steps that you can take to move forward. Then there's the consultation part of the continuum. And this is where you're sort of what we saw in the vignette, where you can offer people the opportunity to give feedback, right? So communication flows to the community and then back to us, and there's some conversation going on. And while again, this is important and valuable, but what's missing here is that people's ultimate authority to make some decisions and really contribute in a meaningful way. Involvement is kind of in this middle area here, and this is where communication flows both ways. There's some participatory form of communication and involves participation with communities on important issues. So this might be, you actually do hire a staff as a part of your research team, or the staff attends your research meetings where they're more meaningfully involved in how the project's going. There's more of a back and forth. But again, sort of missing some key authority and key decisions. So collaborate is kind of your next step here. And again, this kind of deepens community involvement where you're actually starting to co-create project plans together, and you're starting to sort of build consensus from collaborative conversations and meetings. And then lastly, in our ideal world, in terms of how to build community investment and ownership in projects, is around shared leadership, where final decision making is at the community level and entities have formed strong partnerships. And sometimes that might look like a MOU between a community site and the university, where you actually have a formal agreement about what's going to be shared and who makes what decisions. This might be a community advisory board where you have a group of folks who meet periodically to make key decisions about the project and funding decisions, et cetera. So different strategies to engender shared leadership, but that's ultimately what we want to try to get to in the CBPR space at each of these stages. So what I'm going to do here, and Jennifer, I'm going to cue you up and let's just do a few because I see we're at time. I think I'm supposed to go to a 40 after, right?
Roughly speaking, you can go a little later. It's no problem.
Okay, so I'll get through a few of these polling questions and then and then round us out. So what I want to do is I'll give you the examples that I gave earlier around some of our research norms that perpetuate inequalities, and then give you more of a CBPR approach. And then I'd like folks to answer a polling question around what part of the continuum of engagement they think this step is a part of. And no right or wrong answers. I think there are multiple answers, but just want to have you reflect on this for a second. So instead of individuals being approached by researchers without necessarily addressing community stated needs, a more CBPR approach would have researchers offer to host a series of collaborative conversations with school leadership to discuss the theory of change, mutual interest, and potential models for investment. For intervention. So my question to you is, what stage of the continuum of engagement would this be considered? So you should see a polling question in front of you. Okay, let's see what folks said. Again, since we're running up against the clock, let's try to submit these within like 10 seconds or so. Okay, looks like there was some spread there. And I think that's actually really important. I love that there's some spread because I think it depends on what actually happens, what comes out of those conversations and how they go. So it's a great point there. Does anyone want to chime in on how they thought about this?
I can go. I selected the involve one, which I know that was a couple other people did too.
Mhm.
The way that I kind of thought about that was just because the researchers are taking the initiative to like host and collaborate
Mhm.
with the school leadership and have those important conversations about the school needs and kind of those mutual interests.
Mhm.
That is them actively involving the community in the decisions that they're making and the approach that they're going to take to make that change. So that's kind of my rationale for that one.
Perfect. Yeah, great. I think that's a great rationale. And again, I think you can make a rationale for others as well, but I think that makes a lot of sense. All right, let's get through another example. So instead of researchers generating the ideas and the questions and driven by funding priorities and other career imperatives, as I said before, a CBPR approach would have researchers' intervention ideas are identified by and in collaboration with the school leadership, and the research questions are driven by community expressed needs. Then they work together to identify a funding opportunity. What stage of the continuum would that be? Okay, take a second for that. Okay, what do we think? Can we share the results? Okay, good. Looks like the majority of folks said collaborate. I think I'd agree there. Again, not depending on what comes out of that and what happened in that process around key decisions, you can make an argument for shared leadership. But I think collaborate is probably the closest there. Okay, let's do one more. Let's say, let me share this example. So instead of research being primarily disseminated through academic channels and to academic audiences, research findings are disseminated in multiple formats, including a brief podcast format that was sent to participants and a brochure which outlined the research findings and thanked people for their participation. Where along the continuum would the researchers be for that? Okay, let's see a result for this one. Thank you so much. Looks like folks were kind of torn between outreach, again, sort of informing the community, and then community involvement. Again, I think you can make the case for both those. So really, really, really smart. I appreciate y'all's reflection on that. Again, no right or wrong answers. I think you can make the case for multiple answers. So let me move us forward, and I'll try to round us out in the next few minutes. So I want to share with you a real example from my work in Eason. And this was a program called the Family Wellbeing Program that we had rolled out as a part of a community partnership with a local Head Start Center, earlier learning setting, with sort of birth to five, a school that had birth to five, and we were implementing kind of a multi-tiered system of support for parents there. And the vignette that I shared at the beginning was kind of connected to that work. And we had some real tensions that came up between our project team, our research team, and the site. And we really had to step back and revisit our plans and sort of roll out sort of a brand new CBPR based approach that helped to engender more of a sense of shared ownership over the work between our facilitators and our school staff. And these were some of the strategies that we had used at each stage. So what we did was we started to have conversations with school leadership and our facilitators around how they thought the intervention worked, why they thought it was important, and how they felt like their families would benefit from it. Again, as opposed to us imposing what we thought was important to track and to measure, but really start understanding the community's perspective on this intervention and why it was important. We started to just like loosen the boundaries. I think at first we had clear roles around who was research and who was kind of practice. And what that did was it sort of like created this kind of exclusionary feelings around our community practitioners and our researchers. And they felt like many of the decisions that were being made and funding decisions and project decisions were made in the research meetings and not the sort of practitioner meetings. So what we did was we sort of had much more of an inclusive team structure where we kind of did away with those labels necessarily. And even if folks had no knowledge of research and they still wanted to be a part of the discussion and still wanted to have their expertise be shared and heard. So we had a much more inclusive team structure. Um, one of the things that we did was we put together a measure review team, and that was a collection of parents at the school and our facilitators who reviewed our questionnaires and scales and metrics for kind of cultural sensitivity and relevance. And what we did was we ended up sort of making several adaptations to those measures that I think really added to investment and increased participation. At the level of data analysis and interpretation, we had participants doing kind of post-intervention interviews where we had a staff member interview each participant on what they liked, what they didn't like, how they felt like they'd benefit, and they also saw their results pre to post. And it was really, really interesting and insightful to hear what, if folks thought that their pre to post result actually matched their experience. And I think it really actually enhanced our findings and helped to contextualize the findings. And then when we sought to sort of write this work up, we realized that people really wanted to contribute, both, our families and our facilitators. But that, scholarly writing, science writing is a skill. And that not everyone had formal training to be able to contribute in this way. So we started to find ways to have people contribute to a manuscript. And sometimes that was through interviews, through having people write more so in outlines or having people contribute quotations. But just we started to have a series of meetings to support people in how they could contribute to a writing project. And I think all in all, it culminated in this publication, which I think was a kind of an inflection point for our network. We really learned about the importance of CBPR and how, again, you can implement it at each stage of a project. Just really quickly in the next minute, I just want to touch on some of the barriers or this, what makes this really hard. Because again, I don't want to be romantic and naive. Some of this can be really slow and complex and hard to do, but again, pays off on the back end. First and foremost, which I touched on here, which is I think typically we don't get this kind of content in our research training programs like fellowships and master's programs, et cetera. So there's a real role for more education around CBPR. I would say by far and away the most common thing that comes up from my research team is funder timelines. So, a grant opportunity gets posted by a funder, and then all of a sudden we're kind of scrambling to meet the deadline, and that kind of undermines an inclusive process where, we're just kind of, sometimes you unintentionally under-involving people just for the sake of rushing to get to a deadline. So this is a really a common thing that happens all the time. Funder priorities. Sometimes the funders have a set of core values and outcomes that they want you to use, which kind of can be in contrast with a community organization. So that comes up also. And then sometimes, funders really have onerous reporting requirements. Meaning, sometimes monthly or quarterly, they require updates that make it really hard and onerous for our community sites to deal with. And I included this quotation here. This was from feedback that we got from a recent funder who liked our application, but was encouraging us to do more randomized controlled trials. Again, an example of how sometimes funders, we have to enter into a dialogue if it's possible around how some of these research methods can actually undermine community partnership. And again, not that RCTs are bad, they're actually really valuable, but oftentimes we have to be flexible to community needs and interests. And it might look a lot different than your standard RCT and still has equitable amount of value and is knowledge generating. As best we can, sometimes we have to educate funders on realistic expectations and what's actually going to lead to genuine partnership. So my takeaways for today, and I hope you all have had some thought-provoking insights into this. But just to summarize, so historically, academic and community research partnerships have been fraught with harmful hierarchies and inequalities. Again, they can uphold the status quo at times. And that CBPR is an approach to research that can build community ownership and repair relationships. And researchers should maintain a regular reflective practice on where their project is on the continuum of engagement and explore ways to advance. Um, so I wanted to throw in the chat some resources here. I know, again, I'm just kind of whetting appetites, but if you want to do a deeper dive, I'll throw some of these resources that I mentioned in the chat here. And just want to thank you all for your time and attention. It was really a pleasure to speak with you today. There we go.
Thank you so much. That was such an incredible talk and so incredibly relevant as well to the program that we are all in the HAPI program. We do so much reading, research studies, and so it was so interesting to hear your perspectives about community-based participatory research. I can speak for, my classmates as well, but health disparities and racial disparities is also a huge part of, why a lot of us join this program too. So that was great that we got to learn about that today. So thank you so much. I am going to open the floor to the Q&A. It's going to be prioritizing my classmates first and then the rest of the audience as well. So okay, Priska.
Hi, and thank you again so much for that great talk. My question is, what strategies have you seen that work well to ensure community members aren't just participants, but they're actual co-creators of research designs and implementation?
So you're asking, so the question, it sounds like the question is, what examples have I seen or what strategies have I seen gone really well
Mhm.
when it comes to like implementation? Yeah, yeah, good question. And again, there's this like a whole field of study and expertise, so you could sort of teach a class on strategies. And I think the one of the main points I want to make today is that CBPR is not a strategy necessarily, it's an approach. And it's an approach that involves like many different kinds of strategies. So one of the things that I found really important is again that sort of investment in the beginning when a project is just being formulated and conceptualized. So good implementation really starts at the beginning of conceptualization. We draw a lot from, so the Harvard has a school for the developing child or Center for the Developing Child, and they have some really great frameworks for some of the CBPR. And they have this one framework called theory of change conversations, meaning that every intervention has a theory behind how you think it works. What are the essential elements of that intervention, and how does it work to produce an outcome? And you take that theory and you start to have just collaborative discussions in the beginning before you start implementing with key stakeholders like maybe a school leader or staff member or facilitator. And what you end up doing in those theory of change conversations is just sharing your points of view. You're building a consensus about a specific idea. And that to me is key. And what's also going on in that interaction too, as a byproduct, is just relationship building. And you're helping people understand your point of view, your intentions, who you are, your skills and interests. So all that is taking place in these kind of collaborative conversations around theory of change that I found to be a really great just starting place for building a community partnership. And it might just be again, a series of conversations that you have with a potential partner. And and it's not as if you need to come in with a blank slate necessarily, but you might present some initial preliminary ideas and get people's point of view. And I think those are really like key for implementation, is kind of the work you do on the front end before. So that's what I'll say about that. Great question.
Thank you so much. I'll throw a question in there just while people are still thinking of some. Um, but my question is pretty broad, so feel free to answer in any way that you see fit. But how do you navigate some of the power dynamics between institutions and community stakeholders that I'm sure are, present when you're doing CBPR projects?
Yeah. Yeah, totally. And there's no project, and this is like a tenet of CBPR, which is that there is no partnership that's without power dynamics. So, so you can't get away from them necessarily. So I don't think that the idea is not to get away from them, but the idea is to just navigate them in a way that's fully transparent and navigate them in a way that is trying to negotiate them in a more equitable way. And I'll give an example. So going back to the barriers around funding. So typically, as researchers, we apply for grants, we get the funding, and then we distribute the funding based on what's going on in the project. And, you know, the problem with that is, as you said, it sets up this power dynamic where we hold the bag, so to speak. And our participants, our community sites and partners do not receive their funding unless we've decided that they're doing what we've asked them to do, or unless they've like done the deliverable, done the thing. Um, so that becomes a problem. And so one of the many ways that you can try to undermine that is, you can enter into very early on around sort of cost sharing agreements, or ways in which part of the funding or all the funding actually lives at the community site. And so you can start to reverse some of those power dynamics where they have their funding established, and it's not, we're not like holding the bag, so to speak. Um, you can, again, I think like roles and labels often matter where, we may be putting people into a label around like, um, being a practitioner or someone with lived experience, which are important, but then we start to treat them as if they're not included into our decision making or our leadership teams, project teams. So one of the ways to undermine those power dynamics is just to, again, not be so committed to clearly defined roles and responsibilities, but rather having more open-ended collaborative discussions, and just making sure to have um, meeting structures that are as inclusive as possible. And I would say one more thing here too is like sometimes identifying funding opportunities as early as possible is the best thing that you can do, so that you have time to, engage all the stakeholders that need to be involved, start to, lightly define some roles and responsibilities, and that people feel meaningfully involved. Because oftentimes it's the rush that kind of exacerbates the power dynamic where, we just need to get the things submitted and we kind of need to make the decisions based on a rush timeline. So sometimes it just requires being really proactive about applying for funding opportunities, and as early as you can, and start those like collaborative meetings as early as possible. But that's a really excellent question. It gets to the root of CBPR. So thanks for that. I think we got time for one more. Great.
All right, go ahead, Molly.
Molly, you got your hand up. Thanks. Go ahead.
Yeah. So in high school, I was in like a youth participatory action research group. It's kind of hosted out of UPenn. So I was curious if that was something your group has done, because I did think it was really cool to be able to do like higher level research in high school, and also just if like the point of like community based is that you're involving people, like is that something you guys have worked on as well?
Yeah, I think that sometimes we don't use that language, but I think that is like a thematic um, pattern across all of our projects, which is that, I think there's a history where research that's conducted in underserved communities is sometimes observational in ways that are trying to measure disparities or, measure other community problems. And one of the things that I hear from our partners all the time is that like we don't need any more observational research. We don't need any more trying to identify problems. Like, the families know what they need, communities know what they need. And so research should always be attached to action, as you said, action, and some sort of intervention where we're trying to do something or address some issue. So yeah, so all of our projects have some sort of like community action orientation. And I think that tries to like address that concern that many folks have, which is that I don't want to be observed anymore. What are we actually going to do to address this problem? So that's a really important piece too. Thank you for that. I see a question in the chat. Thanks for that, John. So is CBPR expected for ethics approval? I would say not an expectation necessarily. Depending on the scope of the project, I don't think that IRBs need you to have some sort of CBPR approach. I would say that the IRB is really if you're doing human subjects research, again, there's some problems with that paradigm, but that's kind of what we have. If you're doing human subjects research, you really need to have thought through the informed consent part of it. And you can consider different CBPR strategies for how to enhance that, but I would say what is required is that you really thought through how are you going to tell people um, about the voluntary nature of your project. How are you going to make sure people understand what it means for them to participate? What are the expectations? What are the incentives? What will happen if they choose not to participate? Those sort of things. So that's not CBPR necessarily, but I do think there's some CBPR principles in there around making sure people are fully informed and they're giving full consent to participate. So that's what I'll say about that. And I see one more hand, and we're also at the hour. Should we take the question or?
Yes, we can go till
So,
1:15.
Oh, perfect. Okay, great. Sure. Whoever had their hand up, I'm sorry, I missed your name.
It's okay. It's just a quick question, and it's probably like relatively easy to answer. But I was just wondering if, with the approach of CBPR and like implementing that into more studies, have you seen that resulting studies have like community-wide impacts and solutions to disparity problems, or is that maybe more of like a downstream effect that's going to happen later as more like CBPR is like
Hmm.
put into studies? Like, have you seen an overall increase, I guess, in solutions and decrease in disparities, or is that maybe too soon to tell?
Yeah, it's hard to say. I think your question is it's kind of a broad, like looking at the literature and like the landscape of research. I think that in my like partnerships and work is focused on Washington, D.C., so I can only focus on Washington, D.C. I think there is the tide has shifted on some of these issues. Of course, disparities still exist, but I think there's a sort of baseline expectation within our community organizations that again, people are equitably involved and that we're doing something action oriented and that we're addressing real community needs. So I have found that there's enough like institutional memory where that's kind of like the baseline expectations, which is good. But to your point around like have we moved the needle on disparities? I think it depends on like what your measure is and like what you're referring to. And of course there are some, especially in child mental health and in maternal mental health. We're still like above the national average for a lot of outcomes, a lot of negative outcomes. So there's some many needles to be moved, but I think in terms of like research collaborations and partnerships, I think that there's like a we're starting at an advanced level of conversation than many other places. So I think that that's a good thing, a good stepping stone, in other words. Thanks for that question. Dr. Myers, you have your hand up?
yeah, just following up on that.
Mhm.
It's kind of stunning, right? Some of the studies that have come under fire and how far they are removed from the kind of thing that you're advocating from. I mean, going back to the Tuskegee studies, which have been discussed ad nauseam, to the Baltimore shock trauma studies done on the streets of Baltimore with gunshot victims, and on and on. And CPR is definitely a movement that's pushing toward standardization. And I'm wondering, does that even extend toward possibility of some kind of expected training, licensure, accreditation available, maybe not required, but available that a IRB or a funding organization could look for in an application?
Yeah, no, yeah, it's a great question. And I think, what I would say about that is, um, to your point, IRBs are not enough to protect patients. and like plenty of unethical research gets through IRB. So there needs to be added levels of protection and some level of expectation around CBPR, learning of researchers knowing about CBPR. So I think in our platform called City that we use for like research education and our like required trainings, there is some coursework on that. I in my experience they're not very good, and they're kind of just think like click boxes that people just try to get through as quick as possible. So if I had my preference, there would be some like CVPR learning, meaningful learning required for like IRB approval, but unfortunately that doesn't exist. So I think there's a lot of room for thinking about what other like checks and balances we need in kind of standard research. So it's a great thought.
Okay, I leave it up to our moderator to check for last minute questions and to address you at the very end of this. But I just want to thank you for coming today, and sorry for leaning on you so hard to do this, but and not that you were not forthcoming, but I know you're a very busy investigator and clinician, and I think this is just right for our students to be hearing today. So thanks, Corey.
Oh my goodness, my pleasure. I appreciate everyone's time and attention, and I think this group is ahead of the curve in terms of just some of the thoughtful questions that I heard today, and the fact that you're even having this content as a part of your program is fantastic. So it's exciting for me to just contribute. Appreciate it.
Yeah, well, thank you so much again. We really, really appreciate you being here and for your time today. I don't think that we have any more questions. Um, but yeah, so I can turn it back to Jenny. Thank you so much again.
All right, take care. Have a good rest of the day.
Okay, take care and thanks, Noah, and everyone for attending as well.